Then we will see the diameter of the cavity. So its anterior depth is 4 centimeter. As you know that anteriorly it is having the 4 centimeter depth and posteriorly there is 12 centimeter depth. 12 centimeter posteriorly, anteriorly it is having the 4 centimeter. Then first we will see the anterior posterior diameter of the cavity. So midpoint, it is starting from midpoint of the posterior surface of the symphysis pubis. Midpoint of the posterior surface of the symphysis pubis to the junction of the second and third sacral vertebrae. Junction of the second and third sacral vertebrae. That is inner border or formed by the inner border of the symphysis. That is posterior midpoint of the symphysis pubis to the second and third sacral vertebrae, that is around 12 centimeter. Then transverse diameter cannot be precisely measured because there is soft tissues are lying over. So we will tell cavities transverse diameter is all the diameters we will consider as 12. Next we will move on to outlet. So you can see this is called outlet. So the outlet, there are diameters are available over the outlet. First one is obstetrical conjugate. So the obstetrical conjugate, in obstetrical conjugate there is anterior posterior diameter. So outlet having two diameter, that is obstetrical diameter, obstetrical conjugate and anatomical or true conjugate. Don't confuse. So outlet is having two diameters, mainly obstetrical conjugate and anatomical conjugate. This obstetrical conjugate again divided into, first one is anterior posterior diameter. So anterior posterior diameter, that is 11 centimeter, that is it is extends from the tip of the sacrum to the inferior border of the symphysis pubis. So this is the tip of the sacrum. The tip of the sacrum is joining to the apex of the sacrum, or tip of the sacrum is joining to the coccyx. So this is the tip of the sacrum. It is extends from the tip of the sacrum to the lower border of the symphysis pubis. So it is around 11 centimeter. That is the anterior posterior diameter. Then transverse diameter is 10 centimeter, 10.5 centimeter. Transverse diameter is 10.5 centimeter. That is bispinous diameter between the two ischial spine. So this is the ischial spine. This is the two ischial spines are here. Here also, here also. Transverse diameter is 10.5. The distance between the two ischial spines. And also one more diameter is there. That is undergone anterior posterior diameter. That is sagittal diameter or posterior sagittal diameter. That is tip of the sacrum and midpoint of the bispinous diameter. It is the tip of the sacrum to the midpoint of the bispinous diameter. So one more diameter, that is posterior sagittal diameter. That is tip of the sacrum to the midpoint of the spine. So here bispinous diameter is this. So in that one midpoint, if we consider this midpoint, this is the midpoint. So from this midpoint to the tip of the sacrum, that is called a posterior sagittal diameter. It is around 5 centimeter. It is only little bit length, so it is 5 centimeter. So next, so hope you understood the outlet obstetrical conjugate. So obstetrical conjugate mainly AP diameter, anterior posterior diameter, that is extends from the tip of the sacrum to the inferior border of the symphysis pubis, that is 11 centimeter. Then transverse diameter is 10.5, that is bispinous diameter between the tip of the two ischial spines. Then one more diameter is there in DC, the textbook they had given, that also you need to know, that is anterior posterior diameter, that is posterior sagittal diameter, tip of the sacrum to the bispinous diameter. We have to take the midpoint and the tip of the sacrum to the bispinous diameter, middle of the bispinous diameter, that is around 5 centimeter. Next we will see the anatomical conjugate or true conjugate. Anatomical conjugate, there is anterior posterior diameter is there, that is 13 centimeter. It is the widest, one of the widest diameter, 13 centimeter. So this diameter, when the baby is coming outlet, this coccyx will move backward, that's why it is 13 centimeter. It extends from the tip of the coccyx to the lower border of the symphysis pubis. It extends from the tip of the coccyx to the lower border of the symphysis pubis. So it extends from the tip of the coccyx to the lower border of the symphysis pubis. It is 13 centimeter. So in second stage, this coccyx is pushed back, and when the fetal head is passing through the introitus, this coccyx is pushed backward. That's why it is having 13 centimeter. Next one is transverse diameter, that is 11 centimeter. Transverse diameter, other name is bituberous diameter, that is between extends between inner borders of the ischial tuberosity. It is extends between inner borders of the ischial tuberosity, inner borders. That is around 11 centimeter. Then one more diameter is there, that is here also posterior sagittal diameter is there. Before it was 5, now it is 8.5. So it is known as the AP diameter. It is extends from the sacrococcygeal joints. It is extends from the sacrococcygeal joint to the midpoint of the transverse diameter. So in anatomical conjugate, the transverse diameter is between the ischial tuberosity. So in anatomical conjugate, once more you hear properly, in anatomical conjugate, the transverse diameter is inner points of the ischial tuberosity. So here the posterior sagittal diameter is 8.5, that is from the sacrococcygeal joint to the midpoint of this transverse diameter. Sacrococcygeal joint to the midpoint of this particular tuberous diameter. By tuberous diameter, midpoint we have to take. That is around 8.5. So this obstetrical conjugate having the clinical importance. Outlet having mainly two diameters, obstetrical and anatomical. So this obstetrical conjugate having the clinical importance. It is exact diameter where the fetus must pass. So hope you understood. So in this class, we have discussed regarding the bones of the pelvis, then landmarks of the pelvis, then we had seen regarding the joints of the pelvis, ligaments of the pelvis, then we had seen regarding the diameters of the pelvis, then we had seen regarding the planes of the pelvis. Hope you understood. Thank you.